Doctor, always great having you with us. Good afternoon. So some might take offense with two ladies discussing men's wellness issues, but reality is we are sisters, we are mothers, we are partners and caregivers to these men. So their overall health should also be our concern.
Definitely. Good afternoon, and thank you for having me. Very much so. I think we actually have to have, conversation where all genders are involved so that we can really address, the mental health issues, not just specifically for men, but for everyone. But, there's still so much more stigma for men because they do not seek the help that they need for their mental health challenges because of societal stigma. There's always these sayings that men must be strong and men must not cry, feelings are for the weak. So we really need to break those barriers.
And that's exactly what I wanted to say, Doctor, that we live in a society that encourages that phrase of real men don't cry. But what are some of the biggest issues that our men are grappling with in the country, Doctor? We see the stats that indicate that men are at the top end of that suicide bracket in the country, meaning they are suffering in silence.
Definitely, everyone has feelings because we are all human beings. It's the human condition. So you can imagine now if you are not given the safe spaces to talk about how you're feeling and the things that you're going through, it becomes problematic in that you end up then bottling it all in. And then it ends up, leading to things such as self-medication, substance abuse, but even aggression that is projected towards, your partners, the family members. And also then, unfortunately, they are at higher risk for suicide attempt than the other genders. So we really need to be aware that men also need to cry, men get raped, men get assaulted, men also suffer, and yet, they are not seeking the help because of the stigma around. So we really need to break that barrier so they seek help before it is too late. Because whatever it is that women go through, men also go through the same, and it becomes, it comes across as aggression, internalized or externalized, and that's where then we really need to be making sure that we prioritize them seeking the help that they need.
Absolutely, Doctor, because, maybe men should cry more in order to express those feelings more, to avoid carrying these issues internally, which we do know now that it can actually lead to adverse effects on them and those that are around them. As we know, hurt people, and that means also the cycle of abuse will continue.
Definitely. Coming from where we're coming from, we are seeing that, we were raised by wounded people. Now the wounded people are now expected to raise their own children. So the traumas that, they have internalized, they still need to deal with those things, and they project those things. And to that saying, hurt people hurt other people, I always add sometimes unintentionally, even if you were unfairly hurt. So you end up hurting other people who are trying to love you or who are giving you the love, or innocent people such as children, but also sometimes hurting yourself. So it's really important to show how the mind works, is that whatever it is that you are not dealing with, you are likely to project that onto other people. So the wound, you might bleed on people who did not, bleed you or who do not hurt you. So it's really important to really educate people about how the mind works, that whatever it is that you are not dealing with, you are, suppressing into your subconscious, and you will project that. The more you try to avoid, repress, hide, ignore, it's the more it actually manifests in the physical, in the way you behave, act, and react.
And projection, we know, is one of those most common issues that we see as a result of this behavior, as well as trauma, Doctor. So what other ways then, you spoke of stigma here, can men engage in terms of a safe space in order to tackle their issues, work through their emotions, go for those health checkups to ensure their general well-being, not just mentally, especially during this time, Doctor, a lot of additional stress brought by the festive season and also worrying about the year ahead?
Definitely, there's so much expectation from not the society, but also the men themselves have internalized their own expectations, which they sometimes set themselves up for failure because the expectations are so high. So we really need to help them be realistic and to accept also that they haven't achieved the things that they are yet to achieve, but to also understand, to help them understand that sometimes if it's not working in a relationship, it doesn't mean that they are failures, that it's okay then to process is what is happening. And, unfortunately that they might get, a negative reaction for not being able to live up to certain expectations, but that there is help out there to help them process that loss or that inability to do what it is that they want to do, but to also give them ideas on how to actually ensure that their expectations are within their reality and that they're not just, trying the best that they can at all costs in order to achieve the unachievable. So it's really important to have that realistic check-in to see what it is that, that they can do, but to also understand that sometimes family members, you have to, put boundaries around them, which can also cause a lot of conflict. But, to be aware that they're not internalizing that they are failures because their family members are toxic and they're not, able to see them for who they are, because they are human beings after all. And we all really need to show people some grace because of that. And it's not to excuse, bad behaviors that some people display, but to understand that we're all human beings, that things sometimes go well, sometimes they don't. Sometimes they work out and sometimes they don't, even for men.
And Doctor, what are those safer spaces? Where can men go to get this much needed help? And what kind of help as well as checkups can they then undertake in order to identify all these symptoms or early signs of any issues that they might be dealing with, be it mentally or physically?
I think the first step is to just accept that we are all human beings, that even the men will have, physical struggles, mental health struggles, but to also understand that some people are more predisposed to mental health challenges than others. So two people can go through the same thing, but one person gets depressed and the other one doesn't. It's because of that predisposition to mental health challenges, and to understand that with mental health challenges, the more you try hide it, avoid it, it actually becomes more of a burden. So we really need to educate about how mental health challenges develop, but also how they can be overcome, but also approach it in a way that it's safer, in that we talk about it, when someone is not necessarily in a crisis, but more for preventative measures, to say, let's talk about, what depression is, because sometimes we use these terms and people don't quite comprehend, or they often think it will never happen to me, but to really unpack it, in a safe space where we're really talking about what mental health challenges are, how they present, and also how to prevent them, and to also understand that some people are just prone to them more than others, and therefore to show those people a little more grace and a little more support.
Doctor, thank you so much for your great input as always this afternoon. Dr. Keitumetse Mashego, there, a clinical psychologist on Movember, in ways in which men can actually tackle some of the issues that they are grappling with in a safe environment.